Well, I really hate to think about my life without Richie McFarland. I'm not sure where I would be. My parents were great parents, and I'm sure they would have provided for me, but I could have ended up somewhere else in a state school and not gotten the one-on-one care and attention that I needed. And that's what made Richie McFarland so wonderful, because it was in our own community, founded by mothers who were concerned about their children. My name is Amy Dillenbeck, and I'm one of the original students at the school 40 years ago.
Once I got into my medical training, I realized how important quality of life was to individuals, and how important it is for them to have some voice in their cancer management. And I look forward to that in my assessments of patients.
Overall, my feelings for the Cancer Center run deep, because my care here was excellent and I felt that the staff was top-notch. They really were looking out for your best interest. And I did meet a few people after I was diagnosed in my community that were also diagnosed with breast cancer, and ironically had never, thankfully, had to experience coming into this facility. And I just told them, I said, from the second you're going to pull up to the building in the parking lot, you're going to look at this building and you're going to have a warm and fuzzy feeling.
No child ever needs to have a decayed tooth, and some of them suffer terribly from dental disease, and it's unnecessary. And it's the fault of all of us who don't provide the education, the preventive care, and the access to treatment that they need, because we could save time and energy and pain if we could get to them early, teach their parents how to care for them and care for their children's teeth, and make it just part of their daily lives. It's doable.
I do have a part of my job that is the most rewarding, and that is when I see a child for dental services, preventive services, and they open their mouth and they have the sealants retained from the prior year that I've placed, and or they have restorative work done from case management, from working with the parents and the dentists, and they and the H&H Foundation, the parents were able to go and get that care, and they open their mouth and it's healthy. And to think of what that child's mouth looked like the year before, and I'm thinking, oh, how are we going to approach this? And a full year goes by and the child is in perfect health.
Well, definitely participating in sports is a big part of my life, just having something to do, and I think just being able to tell people I can do everything pretty much you can do except for walk. It's just, it's able to give me an opportunity to tell people that I'm no different. I just do things a little bit differently than you do, but I can still get to the same goal.
Aside from the physical benefits and getting out there and actually, playing sports and doing these activities, they've really helped me sort of live a more full life in the community. Just the simple things from, being more confident in social situations, being comfortable meeting somebody or talking about your disability with somebody that doesn't understand it, or just being able to speak in front of people. That's something that I'm much more comfortable with now than I was before. So the social aspect is huge.
When I first met Dave and Sandy, I wanted to know if they had pets and whether I could have them too. I wanted to know if I could have my own room and have some of my stuff here. Not all of it, but some of it. A lot of it I have in storage, but I'm going to get rid of it because I'm starting anew.
Safe Routes to School is a good start, but it doesn't get us all the way there. What are children doing after school? What are children doing on the weekends? Where are they going to recreate? Where are they going to play? And so that's how the Safe Routes to Play project was born. It builds upon the success that the city has had with the Safe Routes to School project and extends it beyond school.
That was a big thing with Wayne. You could lay that all out and everything would come out right, other than just guessing at it. So I could do the bulwark and Wayne could do the brains.
I didn't even know about the project, actually. Dick was on it, and so he approached me one day and said, hey, we need another member to work on the bridge that we're trying to rebuild. So I thought, well, okay, I'll be a warm body.
It's interesting because I look at it and go, now, it was really a horrible sight. Probably worse than, you even wanted to think about, but it's not on a major thoroughfare in Hampton Falls, so I don't see it every day, and I don't have to look at it all the time. But it's kind of transformed itself from a relatively nasty-looking place to a little wonderland down there now. So it's been a great beautification project for that little corner of the world.
What makes Worth worthwhile is that we bring a quality of care that is matching what is in existence in the West to parts of the world where they couldn't possibly get that kind of care, number one. Number two, we do it for either a very small fee or no charge at all, so that anyone can afford it, even the poorest of poor.
If I had to pinpoint one thing that camp really helped me with, it was being comfortable with who I am and where I fit in this world.
I think that what makes Camp Gunlow special is that there's nice counselors, there's nice kids, and there's lots of games.